Are you someone with thin cornea and looking for laser correction? Is there any possibility that we can do it? Well, we have a similar case and I'm going to explain right now. I'm Dr. Advait Sai Alampur, cataract and LASIK surgeon at NVision LASIK Center Hyderabad. So now this patient is basically 29 years of age, and if you see his power refraction, in the right eye is -2 and 0.25 and the left eye is 2.5. Topography reports are relatively normal. Only thing is thickness is borderline. Looking at the map, we can tell that he has some history of rubbing the eyes. Warm colors basically suggest that this patient in this particular areas, the cornea is little thin. Now, ideally in such patients, the options are there. The option we can do a SMILE surgery or a PRK surgery, but we have to do an additional procedure called as extra procedure. So basically what is happening here is in any laser vision correction, we have to remove some tissue. This patient, the thickness is borderline. So basically, let's say this thickness is less. Now, when we have to remove more tissue, when the tissue is already thin, that basically weakens your cornea. So ideally in such patients, we do a procedure called as an extra procedure. Extra procedure is nothing but collagen cross-linking with riboflavin. What it does is it strengthens your cornea. So even after doing the laser vision correction, the cornea still remains strong and there is no weakness of the cornea. For you to fall into this category of getting this procedure done, there is a lot of criteria that we need to follow. This patient is actually suitable for that because his thickness was decent enough and his power also is not very high. That is why we opted for SMILE XTRA. You can either go for a PRK XTRA or a SMILE XTRA. The difference between a PRK XTRA and SMILE XTRA is the recovery period. Again, the SMILE XTRA, the recovery is only 1 day. For example, if you're getting the surgery done today, by tomorrow he'll be able to see clearly. The cornea is also strong. He doesn't have to worry about anything. And ideally in such patients, we tell them not to get into habit of rubbing the eyes. If they already have it, well, don't rub your eyes. If they don't have it, that's well and good. So people who are not looking for lens-based procedure like ICL, who are scared of lenses, who still fall under this criteria where we can still do a laser vision correction, the extra procedure is the best option. So you want to know more about the extra procedure, please DM us extra and we'll be answering all your questions.